Your digestive system is uniquely constructed to do its job of turning your food into the nutrients and energy. When it is done with that, it handily packages your solid waste or stool for disposal when you have a bowel movement. The main organs that make up the digestive system are mouth, esophagus, stomach, small intestine, large intestine, rectum and anus. Helping them along the way are pancreas, gallbladder and liver. Here's how these organs work together in your digestive system.
என்னமா சாப்பாடு செஞ்சுருக்கீங்க? கொஞ்சம் கூட நல்லாவே இல்லை. இதுக்கு தான் நான் ஸ்விக்கிலே இல்லை ஜொமேட்டோலேயே ஆர்டர் பண்ணி சாப்பிட்றேன்னு சொன்னேன். நீங்கள் எங்கே கேட்குறீங்க? வீட்டில் பார்த்து சமைச்சு தரேன், அது பிடிக்க மாட்டேங்குது. வெளியே என்னெல்லாம் போட்டு சமைக்கிறாங்கன்னு தெரியல, அதை சாப்பிட்டு உடம்பு கெடுத்துக்கிறீங்க. ஐயோ, அட்வைஸ் வேறு பண்ண ஆரம்பிச்சிட்டிங்களா? சரி விடுங்க, நான் கிளம்புறேன். எனக்கு வேறு ஸ்கிட்டுக்கு ப்ராக்டிஸ் பண்ண வேண்டியது இருக்குது. சரி, ஏதோ ஒன்று படித்தா சரி. ஆமாம், இந்த டைஜஸ்டிவ் சிஸ்டம் பற்றி இருக்கிற புக் எங்கே இருக்குது? இதோ பார்த்துட்டேன், இங்கே தான் இருக்குது. ஆமாம், நம்ம இப்போ எங்கே இருக்கோம்?
The oral cavity, the first section of gastrointestinal tract where food is break down into smaller particles and well mixed to enter the stomach. The food is mastified by teeth. The tongue mixes the food with saliva. The bolus is then pushes to esophagus near the pharynx. Saliva mixes the food with suitable for swallowing and it contains water, ions, ionic sodium. Oral cavity contains superior and inferior labial frenulum which is present at the center. Soft and hard palate with uvula are present at the center. On the side you have buccal mucosa. On oral floor, lingual frenulum. Salivary gland contains submandibular and sublingual gland. Oral cavity contains mouth, teeth, tongue, lips, soft and hard palates, taste buds. The food is mastified by teeth and mixed with saliva and passes. In men, the teeth are replaced only once. The teeth of the first are known as milk or deciduous teeth and the second set called as permanent teeth. The milk teeth fall out between the age of 6 and 12 years. Deciduous teeth are 20 in number. Permanent teeth are 22 in number, 8 incisors, 4 canines, 8 premolars and 12 molars. Parts of the tooth. Enamel. Hardest human tissue provide outer protective covering of teeth. Dentine. Hard bony tissue forming the bulk of tooth under the enamel. Gum. Connective tissue covering with mucous membrane surrounding the neck of the teeth and adjacent alveolar bone. Cementum is classified substance covering the root of a tooth. Nerves and vessels. Nerves in your dental pulp helps to protect your tooth by allowing sense damage to your tooth as well as changing in temperature or pressure.
My tongue, I am a muscular organ. I am present in the floor of the mouth. A papilla is present for taste. Helps to chewing, tasting and swallowing the food. I secrete the mucus and serous fluid.
I am salivary gland. I make the food soft, which is helpful for the next digestion process. Salivary glands are divided into 3 glands. First, parotid gland. Second, submaxillary gland. Third, sublingual gland. Parotid gland is present in front of the ear, and its secretion are emptied in the oral cavity by Stenson's duct, which is again emptied in the second molar tooth. The total saliva produced by these glands is 60 to 65% and weighs between 14 and 28 grams. This parotid gland is associated with facial nerve.
I am one of the salivary glands and I produce saliva which keeps my friend, mouth and my colleagues, the other parts of the digestive system, moist. Now, I am the submaxillary or mandibular gland and I produced a mixed serous and a mucus secretions and I found on both sides just under and deep to the jaw. Now, I am the sublingual gland and I secrete a saliva that is predominantly mucus in character and I meanwhile reside beneath the tongue.
I am pharynx. I am a part of the throat present behind the mouth and nasal cavity and above the esophagus and the trachea. I divided into 3 regions based on their locations, namely nasopharynx, oropharynx and the larynxopharynx. Functions: I act as a passageway for food on its way to the stomach and for air en route to the lungs.
Esophagus. Esophagus is a muscular tube connecting the pharynx to the stomach. It is about 8 inches long and it is lined by moist pink tissue called the mucosa. It runs behind the trachea. Trachea is the windpipe. Stomach. Stomach has four main parts: the cardiac region, fundus region, the body and the pyloric region. This is the esophageal opening. The cardiac region is the place where the esophagus opens into the stomach, opening of esophagus into the stomach. It is guarded by cardiac sphincter that opens downwards, that is towards the stomach. Then is the fundus region. It is a small dome shape located elevated above the esophageal opening. Body. The body is the largest part in the stomach. It makes up about 75 to 80% of the stomach. It is in this place where the food is stored for around 4 hours. The body, and after that comes the pyloric region. The pyloric region opens into the small intestine. It is guarded by the pyloric sphincter. The sphincter opens downwards, that is into the duodenum. Duodenum is the first part of the small intestine.
Of stomach, it has 5 functions: mechanical function, digestive function, protective function, hemopoietic function, excretory function. In mechanical function, it has storage function and formation of chyme. The food is stored in the stomach for a long period, that is 3 to 4 hours, and emptied into the stomach slowly. The maximum capacity of the stomach is up to 1.5 liter. Formation of chyme. The peristaltic movement of the stomach mix the bowels with the gastric juice and convert into semi-solid material known as chyme. Digestive function. Digestive juice act as mainly on the proteins. Pepsin secreted in the inactive pepsinogen. Hemopoietic function. It plays an important role in erythropoiesis. It is necessary for the absorption of vitamin B12. The protective function of mucus. Mucus present in the gastric juice protects the stomach from the irritation and mechanical injury by the virtue of its high viscosity. Function of hydrochloric acid. Activate pepsinogen into pepsin, kill some of the bacteria entering the stomach along with the food substance. Excretory function. Many substances like toxins, alkaloids and some metals are excreted through the gastric juice.
Gastric juice. Gastric juice is some digestive fluid formed within the stomach. Gastric juice is the mixture of secretion from different gastric glands like fundic gland, pyrolic gland, and cardiac gland. Its volume consists of 1200 to 1500 ml per day. It is highly acidic due to hydrochloric acid. This is the composition of gastric juice. It involves water, solid. Solids have organic substance and inorganic substance. Secretion of gastric juice. There is always a small quantity of gastric juice present in the stomach even though it contains no food. This is known as fasting juice. It has three phases, which is cephalic phase, gastric phase, intestinal phase. Function of gastric juice. Water liquefies the food and swallowed. Hydrochloric acid takes place which acidifies the food and stops the action of salivary amylase. It kills microbes. It provides acid environment for the action of pepsin. Then function of pepsinogen, intrinsic factor, mucus takes place.
Parts of the liver. This is the anterior part of the liver. The anterior part consists of right lobe and left lobe, the right triangular ligament, the left triangular ligament, the falciform ligament, and ligamentum teres. This portion is ligamentum teres. And this is fundus of the gallbladder. Posterior part of the liver. The posterior part of the liver consists of 4 lobes. They are right lobe, left lobe, quadrate lobe, caudate lobe. And this is inferior vena cava. And this one is gallbladder. And this is hepatic artery and portal vein. And this bending of the gallbladder is called cystic duct. And this is bile duct.
Liver. Liver is the largest gland in the body. It is endocrine as well as exocrine in nature. It weighs 2% of the body weight in adult. It performs more than 500 functions. It is the second biggest organ next to the skin. The liver is situated in the upper right of the abdominal cavity. The liver is wedge-shaped and is reddish-brown in color. In male, it weighs about 1.4 to 1.8 kg. In female, 1.2 to 1.4 kg, and in newborn, 150 grams. We have 9 quadrants of the abdomen.